we are interpreting an MRI, the first step is to look at the actual images and not just a report. So these are the vertebral bodies, these are the discs, these are the nerves. This is the back of the spine and the back of the patient, and this is the front. So first of all, on this T2 image, what is white is basically fluid, right? And then anything that is gray is going to be either bone or disc or muscle or something of that sort. And then fat is going to be a little bit white as well. So the first thing to look at is the spinal canal itself. And it looks pretty patent. And then we look at the actual discs, and we can see that some of them are obviously less fluff than others, right? So they're a bit desiccated from degeneration. And then we look at the alignment because we want to make sure that there's no slippage of one vertebra on another one. And in this specific case, for example, you can see that the L4 and L5 vertebra are not very aligned, right? So that's what we call spondylolisthesis. You can see the shadow right here of two objects. So these are basically screws. This patient essentially has had a posterior fusion at the L5-S1 level. When we look at the axial image, so now we are at the L5-S1 level, and here you definitely have even more of a narrowing picture, right? So there's probably moderate stenosis on both sides. So this is what we call the facet. So the facet joints are what allow the spine to move. Essentially, it looks like a hamburger. There's definitely more fluid in this one than this one.